to us today about naturopathic physiotherapy in digestive disorders. Let's give him a round of applause. Thank you.
Thank you. I always enjoy these international conferences. The International Congress here. My university work was actually in cross-cultural medical studies and cross-cultural religious studies. So in 1992, I presented on an international conference in Cairo on the history of voodoo and the social structure and relationships and the tumultuous history of Haitian past, how it shaped belief systems, how the individuals involved, etc., would shape eventually the syncretic religion that became known as voodoo. Here, almost too many years to count later, it's wonderful to see the iterations of the international spread of naturopathy around the world as we come together. It's so many different shapes and faces, cultural expressions, legal status, types of clinical practice. And I hope that the presentation today speaks something to all of you. I said last time, I spoke a couple of years ago, that I think this is an incredibly important Congress, this international collection. Not only that we interact and maybe we get our personal benefit from it, or our gain, or our enjoyment. I love to see Dr. Brown, for example. I could always use a little bit of English humor. But also in very practical aspects and outcomes. I currently have fellows, regular medical doctors, physicians who do rounds now at the clinic. And they do that as a part of a fellowship that was developed based on protocols that came out of committees developed from this Congress and their influence of the World Health Organization. And that development of truly integrated medicine and our interactions with one another for the benefit collectively of all of our patients is a very real outcome that comes from our involvement here. So I would like to thank the organizers. I would like to thank Dr. Narboni. I'd like to thank Dr. Zarenka for the revision, and also the executive committee and all those who do this work. It's incredibly important. So I'd like to give them a round of applause and say thank you for that. So I'm going to speak on physiotherapy and digestive disorders. Digestive diseases in the United States affect a significant number of people, 1 in 5 persons. There are 50 million healthcare visits annually in the United States. 22 million are hospitalized. If you put all of the numbers together as to leading causes of death, it ends up being around the 3rd leading cause of death in the United States. The annual healthcare costs are around $142 billion. So today I'm going to present cases on IBS. I would agree with Dr. Brown at presentation on the first day that irritable bowel syndrome is really simply irritable bowel symptoms. It's a diagnosis. It reminds me of the type of diagnosis I call these the sky is blue diagnoses. It means nothing. It just tells us that the sky is blue. And I agree with him that there isn't much behind that. There's much more in terms of cause. And I hope to get something out of it today and to how to treat that. SIBO, or small intestinal bowel overgrowth, chronic reflux, nausea, acute cholecystitis, and we'll talk about some digestive cancers. The physiotherapy treatments will really be the focus. Dietetic regulation, herbal medications, digestive enzymes, probiotics, these are commonly known naturopathic interventions. In the modern era, naturopathic physiotherapy, it's less well known, despite more than a century of continuous clinical use. So let me speak to that a bit. So these naturopathic treatments, these physiotherapy treatments, they're entirely compatible with any herbal, homeopathic, nutrition, even pharmacological and surgical approaches. It's truly integrated. The cases here are all treated with comprehensive naturopathic care. Most have already failed conventional care or had failed naturopathic care in one way or another. The focus will be on the physiotherapy component, with which these cases I do not believe would have been successful, and I will speak also to the other portions of the program, but only briefly. Our clinic that I directed sees 40 to 60 patients each day. We'll see about 10,000 patients annually. We'll see urgent care, acute care, chronic disease care, or primary care. We have certain specialist care, cancer, oncology, autoimmune diseases, etc. And our system of clinical naturopathic physiotherapy is actually a direct lineage from Friesnitz and Knight. Knight, of course, is influenced by Friesnitz, so there's no argument around that. Who trained Lindlar, Ledoux, List, who trained Budgie Carroll, who trained the Dicks, Dr. Scott, Dr. Dick trained myself, and the younger Dr. Dick, Dr. Metro, And we've actually evolved this system to incorporate acupuncture and modern naturopathic physiotherapy, and we call our treatments biothermal therapy. The treatments typically last about an hour, 45 minutes. They're often integrated with various manual therapies, IV therapy, injection therapy, adjacent, not simultaneously, the physiotherapy, as you'll see. This is a layout of our clinic in the center here. If I can speak to this, I have a pointer. Maybe I don't. So in the center there, you'll see our treatment tables. On one side is a hallway for patients to enter. On the other side are drapes that they close and they change and they open up, and so that our staff, our assistants, come in with the mobile carts to apply the different physiotherapies that are prescribed on any given day. You'll see the doctor checking in a patient on the bottom, putting in acupuncture needles, then we'll see the treatments being applied by the nurses. And then, of course, we have regular complete examination rooms, etc. So, I'll first just review a little bit about the different physiotherapy modalities. The hydrotherapy we'll be speaking to is really a Kneipp pack, or a Priesnitz pack. It's a cold water pack that's applied to the body, well wrung out. The body will warm this. These are not photos from the clinic. This is actually Wiltz's Encyclopedia of Natural Healing. And these can be leg packs, ankle packs, torso packs. The initial cold application leads to a vascular constriction, and then a secondary vasodilation with a reaction. It's that reaction which rewarms the towel and sets up an undulating pumping of the circulatory current while the person is at rest. And this can be used to manipulate physiology in a number of different ways. Here's a neck pack, a leg pack, the wet sock that the speaker spoke to yesterday. That's really what that is a sock pack. We'll be talking and using really only one today. It is the constitutional hydrotherapy method, which is an anterior application of warm to the torso, followed by the cold pack. The warm is there to enhance that vaso reaction and to make it more palatable and to speed it up for a clinical setting. And it covers really from the clavicle to the hips. It is really a modified Kneipp torso pack. Carol was trained by me in the Kneipp methods extensively. He wanted to make these more efficient in the 1920s. So he split it in half, anterior and posterior packs, hot, cold, combined with the various electrotherapies. And we've evolved this clinically over the last century. Galvanic or direct current is what you see in a car battery or an old battery. The current flow is considered to move from positive to negative. Actually, the electrons move from the negative pole to the positive pole, but the current is considered to move from positive to negative. If that's not confusing, that's you can blame me with electricians. So we're going to be using it for its electrochemical reaction. The positive pole acts to constrict tissues. So it relieves acute inflammation. It's good for ulceration and hemorrhage. For example, last week we had a woman who had been having her menses for 2 weeks very heavily. So we put the positive pole over the uterus, and that day it slowed down and it finally resolved because it causes that constriction while we work to treat the underlying cause. This is useful for ulcerations in the digestive tract, etc. You can also use it to drive positively charged ions into the tissue, such as silver for infections or procaine for chronic pain. The negative dilates the pole, it attracts hydrogen, it relieves chronic inflammation, it softens scars, it dilates. This is particularly useful. I won't give you a case today, but when you're dealing with hepatic torpor, hepatitis, both acute and chronic, you can put the negative pad over the gallbladder. The bile acids having a negative charge are pushed into the digestive tract, thus relieving that hepatic torpor, and you can reduce liver enzymes, liver inflammation, both acute and chronic. And the active pole is always the smaller of two pads. This is a very commonly used current in electrophysiotherapy, the low-volt alternating current, a muscle stimulator. It's not a tensement in any sense. It has no polar action because it is an alternating current. We use it in a ramped form, on and off, to stimulate spinal reflexes. It can be used in the constant current, which I'll describe later. It's a predictable physiological effect, all a byproduct of neurologically elicited vasomotor and muscular activities. It leads to increased arterial perfusion, return of the venous supply, and then increased lymphatic circulation. But we will be describing its use today in the spondylotherapy method, widely used extensively by the naturopathic profession for the first 60 years of our clinical experience, using the spinal nerve reflexes to influence internal organ function, to enhance internal organ function, digestive enzyme secretions that have specific tissue effect. For example, when the pads are produced on either side, placed on either side of the spine, T5 through 8, we'll get pyloric dilatation, duodenal relaxation, gallbladder contraction, dilatation of the kidneys, the vascular bed, vascular dilatation of the liver, and gall duct dilatation, which will be useful when we talk about acute cholecystitis. If we put the pad at the lumbothoracic junction and the other anteriorly over the small intestine, over the umbilicus point, we call it, to treat the small intestine, we'll get suprarenal function enhanced, pancreatic secretions, splenic contraction, and jejunum stimulation. And finally, another example we'll be talking about today is to put a pad anterior and posterior over the hepatic region on constant current. This helps to decongest for venous hepatic drainage, bile drainage, relax the gallbladder, and also improves glucose regulation. There's a poster online about that for diabetes, for example. Shortwave diathermy. It's extensively used today around the world, though unfortunately not as much by naturopathic physicians as I'd like to see. It creates a deep velvety warmth, and it is a high frequency. There's no muscular contraction. We use this for infections. 80 years of safe clinical use. If you treat respiratory infections, you really should have shortwave diathermy on hand. We'll be using it today for its use in colitis and inflammatory bowel disease. Predictable physiological effects of this non-ionizing radiation, which I know that word makes people nervous. Please don't be. It's in the radio wave frequency. It's entirely safe, and the research is quite clear on that. Heat, increased capillary and tissue perfusion, improves cell and membrane permeability. It improves transfer of metabolites across the cell wall. Cell membrane, increases white blood cells locally. It increases local metabolic rate. It decreases pain by increasing the pain threshold. It decreases tension and collagen. It enhances phagocytosis. It decreases fluid viscosity. And these are all well documented. This is from Naturopathic Physical Medicine, a text that I co-edited with Leon Chaitow several years ago. The indications, if you look at them, you'll see infection, infection, infection in all of its various forms. But it has so many other uses beyond pneumonia, prostatitis, and acute prostatitis, bronchiectasis, bronchitis, etc. And I hope to show you some of those today. High frequency, sometimes called bilateral, which is unfortunate, or bilateral, which is inaccurate. It is a high frequency. It has a variety of different applications, applied similarly to how an ultrasound may be, but with quite different outcomes. It leads to improved blood and lymph flow for 24 hours after application, improves oxygenation, it reduces inflammation, it improves elimination of waste out of the pseudophorus glands. It's topically germicidal. It encourages leukocytosis, it enhances phagocytosis. It's antispasmodic, anti-inflammatory, and it encourages tissue repair. So it has a lot of applications clinically. I'll be describing some of them today for the digestive bed. We want to use it wherever we want enhanced circulation, we want to moderate inflammation, reduce pain, and we want to heal tissues. For tissue traumas, infection, inflammation, arthritis, psoriasis, eczema, colitis, diarrhea, neuralgic pains, ovarian pain, dysmenorrhea, cysts, fibroids, upper respiratory infections, particularly asthma to reduce spasm, urinary tract infections, interstitial cystitis, anywhere we wish to biologically modify the organism for that application. Acupuncture, this is actually a slide that we use in our patient education to help them understand that the nerve energy flowing over the body in these meridians is directing the blood to heal the organs, and we would want to open up any of those channels that are blocked, like a garden hose to water the garden. And it's actually, maybe that's an older way to describe it, but that's exactly what modern research shows. For example, the use of stomach 36 on the lower leg and PC6 on the wrist for GERD and functional dyspepsia via the somatoparasympathetic reflex is the mechanism of action by which the acupuncture works. So these older terms or concepts that we have and sometimes are actually merely accurate, and it's really a language difference. So those are some of the biological actions that I'll be speaking to specifically today, but there's a general application or a general benefit when we use these naturopathic physiotherapy treatments, and that is the reduction of inflammation and the to encourage healing. So this is what a healthy peripheral blood smear will look like. This term, look at the blood under a light microscope after it dries. A peripheral smear has a variety of different names. It's really all just peripheral smears. This is one that has an elevated inflammatory pattern. When the blood does not clot, when it does not go through its natural clotting mechanism, because there are inflammatory chemicals in the circulation, it causes on the peripheral smear an opening or gaps that form and pools of plasma are visible. This here, if you can see it quite clearly, I think really the concept of naturopathic toxemia is the best way to describe this, not uncommon slide. It is pale with a brown central circle. Those are actually colon waste being reabsorbed from through a leaky gut due to an overgrowth of unhealthy bacteria in the intestinal tract, and they sediment to the center of the clot. So this is an old quote that I love from one of my favorite little pamphlets, The Principles and Practice of Naturopathy from 1927. And I will just, as an aside, be putting up blood slides so you can see the changes of the cases as we go through them. And this is an example that I'll often educate. This is a fellow who didn't have skin up to his knees or elbows for about a decade. He was in chronic renal failure. He had elevated liver enzymes. He was overweight, high blood pressure, pre-diabetic, and the list goes on. He came in for the first time in his 60s for naturopathic treatment because he was at his wit's end. And you can see over time the healing of that tissue and the changes that occur in the blood and the peripheral smear. This is a woman who presented 1 week after having a tumor surgically removed from her heart that was putting her into AFib, and that's her blood as it transformed. Now, his blood, he would drive 6 hours to see me. That is after 6 months. Once a month he would drive in for a treatment. This is a woman who came in 12 times in 1 month for these treatments. The general benefit is the reduction of inflammation, the enhancement of internal organ function to improve the body's capabilities to heal itself. So my first case is a 20-year-old man. He has 5 years of stomach pain that wakes him from sleep. He then begins vomiting for several hours every morning since he was 15. He has loose stools and diarrhea 2 to 3 times daily. For the last 6 weeks, he has had a global skin outbreak. He can't sleep. He's exhausted. He's acne. He can't socialize. Steroids only made his symptoms worse. He'd been trying some various natural techniques that weren't working for him, so he came in a couple of hours from the coast. So that's his blood on day 1. Here's his skin, if you can see that over there. So this is after 12 treatments, around 6 weeks or 2 months. Serial improvement. At this time, his stomach's perfect. He no longer has nausea and vomiting. His skin's resolved. He's playing tennis. In his words, he says, it's like a miracle. Really a sweet guy. That's his skin there at 6 weeks. And then once we had that, we gave him another series of treatments over a longer period of time. More slowly, once we had the blood healthy, he was symptomatically better. And that was, his skin looks just amazing at that time. So he's doing great at a couple of years of follow-up. Yes, quick question? I'm going to go over right now. So I was going to present that first, I know. I hope, yes. I hope I don't get too far ahead of myself. So, what is the treatment? So, we're going to avoid food intolerances for him. He was put on calc floor, which found to be a nutrient deficiency. I gave him a nutrient complex, a whole food nutrient complex for the kidneys. Some Chinese herbal formulas to address gut bacteria. But he had been trying natural therapies under naturopathic traction already for several years. It's the treatments that really began to make the difference. So we used the modified Knife pack anteriorly. Then, because he had the loose stools, we did the abdominal diathermy, that deep penetrating heat. Wonderful for colitis, wonderful for diarrhea, 10-minute application. We then did the application of the Knife pack to the posterior portion of the torso, and then we did high frequency to the lumbar region over the kidneys to encourage, for the next 24 hours, the elimination of waste as the body was healing and purifying itself. And we also used acupuncture, large intestine 11, stomach 36 to clear heat, improve nutrient absorption, etc. During this treatment. So we put the towels on. We did the anterior. We did the diathermy. We used a pad anterior and posterior. We did a pack on the back, the high frequency over the kidneys. Now, he continued to improve at the 8th treatment. This is around the 3rd or 4th week. We changed because he was no longer having the loose stools. So we then changed to the low-volt alternating current, that spondylotherapy treatment, to enhance or tonify internal digestive organ function. So we did the towel pack anteriorly, then we put the pads along the spine, as I showed earlier, to improve internal organ nutrient absorption, healing of the gut lining, digestive enzyme secretions to pack to the back, and then continue with the treatment of the kidneys with high frequency and the acupuncture points. By the 11th treatment, that's when he reported it looks like a miracle. I really don't have those symptoms. At his checkup at 6 weeks, his stomach is perfect with no symptoms. He was sleeping, his insomnia, all of that was better. And then here's that application here along the spine of the spinal reflexes, approximately T5 or T8 is where the application is made. And here's the high frequency. This is a picture of all the wands and conductors together, the different types of probes and applications that can be used. Our next case, this is a 27-year-old woman. She had lifelong stomach pain, heartburn, nausea. It had been worse the last 3 years. She was sick after every meal. She's nauseous when she wakes. She's sick for several hours every morning, sometimes all day, unable to work. She's on omeprazole, Zofran for nausea, iron for anemia, and medical marijuana, and that's how good things get. So she came in, and you'll see this progression here as the blood transformed. She had relief at 6 weeks. She stopped the Zofran, her marijuana was no longer needed. After 12 more treatments over 3 months, again, you'll see we slow down on the application of the treatments as she improves. She has no symptoms at all. We then began to wean off of the omeprazole. People oftentimes try to come off of that too rapidly, and they have a rebound. It's like a volcano gets released. And by 6 months, her only symptoms occurred when she ate her food intolerances. By a year, she had a new lease on life. She has a new job. She's doing wonderfully. So what do we do? So dietetic treatment, we tested for food intolerances. We used a Spangler Sand OM. We gave her a food-based iron for anemia. Again, nutrient concentrates to support the liver and the kidney, and then the physiotherapy. So I corrected a hiatal hernia that she had, and also I restored a dropped kidney to its position. This is an old technique, naturopathic visceral manipulation technique, which I'll speak to in just a little bit. After Jacob Thaler and White, Dr. Jacob trained me on these. We then applied the modified connective torso pack. These were the treatments that we gave her, a series of modified connective torso pack to the anterior. We then did the spondylotherapy, those applications along the spine to work on the internal organs through the nerve reflexes. We then did a surging abdominal treatment. We would put it over the stomach, sometimes over the umbilicus, whether we're treating the stomach or the small intestine. We would then put a pad anterior posterior over the liver to encourage drainage of the bile and elimination of the waste. We did the pack then on the back, and then high frequency over the gallbladder or along the spine for her nervous system depending. And our nurses administer these treatments simultaneously, 5 to 7 happening all at once. So again, here's this application. You can see the pads up at the top here along the spine. Then the umbilicus spot, etc. It's a surging current, comes on and off very gently. We use it on pregnant women. We use it where it's entirely safe. We use it with children, infants. This is a picture, not in my clinic. That's Dr. Thaler on your most left, Dr. Jacob in the middle, nurse administering chromatic anesthesia, and Dr. White, who ran a hospital in Oregon in the 1950s. People would travel from all over for what they call bloodless surgery or visceral manipulation. They would reduce take care of slit discs, ruptured spinal discs through the abdomen, to restore kidneys, drop hiatal hernias, etc. And I had the good fortune to be trained by Dr. Jacob in many of those techniques. So our next case is a 46-year-old male with chronic mid-back pain. He also has bilateral hip pain for 1.5 years. Physical therapy workup, we can't really figure out why he has the back pain. He has chronic abdominal discomfort and pressure. It's negative with a complete GI workup. There's no reason, you have no symptoms, you're okay. I don't know if you've ever seen these patients before. Everything's okay. Right? You don't have any problems. Well, use a different tool to test. So we changed his diet. We put him on his mineral deficiencies, gave him Spanish black radish and a couple of nutrient concentrates. We gave him 12 treatments. Once a week. He's a busy executive. We also treated him for chronic hyperventilation syndrome, something I would encourage all of you to look into. And we really treated primarily with physiotherapy for his back pain, which actually rapidly improved. And around the 6th week, as he was getting better, this is important, the 6th week, the 6th period, the healing time of reaction, if you're using these type of treatments, his mid back pain had significantly improved, and he developed a gastritis that he had historically, which he began to talk about more specifically. And so we did an H. pylori test to confirm it wasn't H. pylori ulcer. We used Chinese herbal formula for gastritis and some DGL, and then we changed the naturopathic treatment, which I'll get to in a minute. And within 10 days, that was resolved. That was the corrected hiatal hernia. and we continued treatment after that to heal the lining. And at this point, I was communicated, again, a layer of his history, that he has this upper right discomfort that develops, which actually is where all of this started. And so really what we're looking at is how, using naturopathic treatment, and we describe this in our older text because primarily naturopathic physicians used physiotherapy historically, that's what our large treatments were, and it unpeels the layers of healing. So his back, as it healed, gastritis as it healed, and finally, it really was coming from his liver, a toxic bile that was refluxing into his stomach, causing gastritis, which was causing the back pain through spinal reflex irritation. And this is his blood on the first day when he came in, and then that's it at 3 months. You can see the transformation. So what do we do for him? So we treated him with manual therapy, soft tissue manipulation after chai tao and leaf. We did the modified knife torso packing anteriorly. We used the low volt alternating current along the spine. We then treated the stomach. And we added a session with one pad underneath each of the feet on a constant current to relax the hips, improve lower back circulation, also through the extremities. And we did acupuncture specific for that low back pain. As that healed, his back pain finally resolved, which he had and had not really responded to previous treatment. He had that gastritis. So then we changed to that galvanic current. That acute inflammation and gastritis responds very well to positive galvanic, particularly when you put the protein on the electrode, push it into the tissues to reduce the pain and the inflammation. It's a 10-minute application. We also did high frequency over the stomach to encourage tissue healing at the end. And we changed to certain heat clearing points like large intestine rather than stomach 40. As that began to improve, we then switched the treatment to treat this underlying toxic bile and hepatic function. And there's a picture of that galvanic, that direct current. This is a 39-year-old woman who came in. She had recent significant weight loss, constipation. She had a fever the previous night of 101 with right rib cage pain. She came with a tender abdomen the next day. We ordered a blood count, a metabolic panel, bilirubin. She was in acute distress. We gave her a 42 cocktail, 4 parts wormwood, 2 parts Cape aloe. We then put the spinal therapy with electrotherapy to the spine to clear the gallbladder. I diagnosed her as acute cholecystitis. We gave her Berber's homeopathic, gave her our after-hours numbers. She came in the next day. The symptoms had all improved and resolved. She had a non-tender abdomen, a negative Murphy sign. Her direct bilirubin was elevated. Her ultrasound, which I had ordered, showed that she did have a polyp. That means there's chronic discharge of irritating bile that's leading to chronic inflammation. Usually it's elevated cholesterol. She probably had some small stones that were able to discharge in interim because there was no evidence of stones at that point. Why do I say that? Because the direct bilirubin was elevated. And that means that there was obstruction, which we treated acutely. So there's a variety of ways we can use these treatments. This is a woman who came in, 68 years old, with 20 years of ulcerative colitis. They were going to remove her, she had pancreatic, they were going to remove her colon with a total colectomy. In this case, inflammatory bowel disease responds very well to shortwave diathermy. It's been described since the 1940s for that application. So we avoided food intolerances. We used a modified night pack. It's redundant. Shortwave diathermy to the abdomen for 10 minutes. High frequency around the navel initially when she presented. And then a combination of those two. She's had a 10-year colonoscopy. I wrote this case up in 2007 to describe it. 10 years of colonoscopy shows complete remission. She still has her colon. A 19-year-old man here presented post-appendectomy for right lower quadrant pain, consistent with appendicitis. He came in 3 days later because he had a discharging drain. There were no local signs of infection, but he was discharging pus. I ordered an ultrasound. He had a 5-centimeter abscess still, and that's what they originally removed, and in 3 days it was back. So in this case, I treated with that galvanic, that positive current to push argentin or silver as an antibiotic in there locally. He also took oral antibiotics. I gave him an immune IV drip. We gave him a few treatments, and it was stable. At 1 week, we did a CT to make sure the surgeons didn't want to go back in there. They weren't sure why. After appendectomy and removal of the initial abscess, it returned so quickly. They were in no rush to get another one. So we gave him a series of treatments. We ran current with the low volt alternating current through that right lower quadrant. And at the 6 treatments, he had, within 3 weeks, normals, painless BMs, no fevers. And he had 6 weeks ultrasound confirmed that we had resolved his abscess. And we got him that to resolve. He didn't choose to pursue long-term care to address the underlying cause, so I encouraged him. This is his blood at presentation. This is his blood when the abscess was resolved. 1.5 years later, he came back, or 15 months, excuse me, he came back after he deferred care. He had another flare. It turns out he has Crohn's disease, which we're now treating, began treating. So this is another case, Crohn's disease in a 24-year-old male, also presented in a similar fashion. We came into it later, though, after he'd had the appendectomy and the fistula. He was on Delzapol, it wasn't working. They were going to prednisone. They were upping what they were going to do for their treatments in terms of the intensity. He didn't want to do that. We used the torso pack, the shortwave diathermy. And at 2 months, we reduced the treatment once we had the blood healthy, and we treated him over time, and he's now in remission and off all of his medications as we walked him off of them. So the physiotherapy treatments, along with what we do, whatever you're treating, can be very useful. This is lastly, some cancer cases. This is a man in 2012. He had type 2 diabetes, autoimmune hepatitis. He had primary hepatocellular carcinoma. They gave him 6 to 12 months to live. That's his blood at 6 months. He is alive 6 years later. I also treated his wife. She's 9 years in remission for lymphoma. This is a 66-year-old man. He had stage 1 colon cancer. He said, well, it's only stage 1. And I said, yes, it's stage 1. That's the time we want to get rid of this. So he had been trying other techniques, naturopathic. He was progressing slowly. I did a couple of colonoscopies. This is his blood after he did a series of treatments, high-dose IV vitamin C, and it improved. I said, I want you to go in. I finally talked to him into getting the surgery. When they went in, they had to rely on the tattoos. The tumor had receded. It had largely healed. He was a little upset. I said, no, now we know it's gone. And actually, when they did the pathology, there were still some cancerous cells. And I think that surgical reduction of the tumor mass can be very useful. This is a 62-year-old man, stage 4 pancreatic cancer, diagnosis with liver mets. They gave him 3 to 6 months, and 4 months is what they had predicted most likely. He came in, we gave him 16 treatments in 12 high-dose IV vitamin C treatments over the course of about 6 weeks, our anti-cancer program. He went in for a scan. His tumor had shrunk 30%. The tentacles had receded. And they were able to do the surgery. He survived another 18 months. He did not do follow-up care after the surgery for whatever reason, even though we had given him that. But I'm glad we gave him that opportunity. In this last case, this is what I'd like to dedicate the talk to today. This is a man who's 74 years old with the diagnosis of primary esophageal cancer. Next to the lymph nodes, adrenal glands. He had diagnosed in November of 2017. He had chronic gastritis treated with PPIs, chronic gastritis. And at diagnosis, they said, you really have a few months. So he came in to see us at a few months, actually, in February of this year. Severe cachexia had set in. We pursued an intensive protocol of biothermal therapy treatments, the anti-cancer diet, herbal medications, IV mistletoe, IV artesunate. And that's his blood at 1 month there. And the day before that, we had a CT scan. And he had originally had around a 7-centimeter primary tumor. And the CT, which was performed in a different imaging center than the first, remarked that the esophageal pull-through surgery, the gastric pull-through surgery, was a success. They had removed the tumor surgically. They had just done treatments for a month. And there was a small soft tissue mass. Now, unfortunately, that primary cancer, when you get those to shrink, sometimes the metastases blow up. He did survive an additional 3 months beyond his prognosis. His family was so happy that they found naturopathic care. We are forced to be reckoned with. We have so much to offer our patients. We put this together in a comprehensive program. They were delighted at the time that they got, and he actually lived out until last week when he finally did go into hospice care, and we walked him through all of that. A wonderful man. I'm glad we could have that time. And she remarked to me when I asked if I could dedicate the talk to him and in his honor, that she knows now that had she come in earlier, if he come in earlier for treatment, he probably would have prevented that in the first place. Because what we do is treat the cause and not wait for the symptoms to erupt. And it really was true. This is just a quote from Dr. List in 1927. Medical doctors have taken the synonym for the name of our science, naturopathy, and translated it into its Greek synonym, physiotherapy. So they changed it and arranged it with the powers that be, that a naturopath cannot no longer practice his art. He must be a physiotherapist.